Poverty and Homelessness Board Executive Committee meeting. And I would like to do introductions really quickly. So if we, my name is Sean Murphy, and I am the chair of the Poverty and Homelessness Board representing mental health. Go over to you, Matthias. We're going to start at the table and then we'll.
I'm Matthias Smith. I am the youth representative.
Thank you. Sorry, I mispronounced your name.
Lucy Venice, Mayor of Eugene.
Mike Flood, Vice Chair for Homelessness.
Andre.
Kelly Walker, HMIS Supervisor.
Jordan Rose, Student Attorney.
I'm James Yolen, the Homelessness and Community Action Manager.
I'm on Board of Director of ESS.
And then on the video, we'll start with Commissioner Farr.
Good morning, Pat Farr. I am a member of the committee, and I apologize for not being there. We have a budget committee meeting that starts at 1. I'll be leaving here at 12:58 with apologies.
And Ms. Miller.
I'm Chelsea Miller. I'm the Director of Operations at the Eugene Mission and just here until we have a member on the board.
And Dr. Foster.
Dr. Willie Foster. I'm the chair of the Health Committee.
And Ms. Fifield.
Erin Fifield, staff at the City of Springfield.
And we have Diana. We're moving. Diana.
Hi, Diana Aldridge, clerical support.
Rosie. Then we'll move forward to Dominique.
Hi, everyone. Dominique Lopez Stickney. I'm Trillium's Senior Director of Medicaid and a guest today.
Amanda.
Hi, Amanda. I'm a Senior Program Services Coordinator at Lane County. And I just realized there's another Amanda, COC staff.
Elliot.
Hi, my name is Elliot Sky. I am a program manager at Pacific Source for health-related social needs and here to present. I'm glad to be here.
And okay, I think you guys are moving. Tyler Stewart.
Yes, Tyler Stewart from Whiteberg Clinic, IT coordinator.
And then Terry H.
Hi, my name is Terry Shea. I'm the outreach manager at HIV Alliance and the direct service representative on the PHP.
Did we get everybody?
Not anymore.
Oh, wow. Okay. And I think we have the executive team. We've done introductions and I am trying to stay on target with the schedule. So I apologize, but I want to welcome everybody if I didn't get to you this afternoon. And so we're going to move forward with the agenda that we have today, which is the consent agenda to approve the minutes from March, accept the April 2024 financials, and the all-in funding dashboard. And then on the presentation we have today, the coordinated care, HRSN benefits and capacity building grant presentation, the draft discussion on the strategic plan, and then bringing Carly back to continue from what we tabled last time about the system map data, the jurisdictional updates, the draft agenda for the June all meeting, and then the wrap up. So would anyone like to make a motion to approve the consent agenda?
So approved.
Chair Murphy.
Yes.
I move approval of the thank you, Chair. I move approval of the consent calendar.
Second.
Okay. So Commissioner Farr moved and Councilor Flex second. All those any discussion? All in favor?
Aye.
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 Unanimously passed. Thank you. And we are going to move right on ahead with the presentation on the HRSN benefits.
Well, really,
did I miss something?
no, really very much want to thank Dominique and Elliot from our local CCOs and Trillium and Pacific Source for being here today. Chair Murphy has brought up a number of times that there's lots of questions related to the capacity building grant for the HRSN. And then just the HRSN, particularly the rent assistance benefit, that's going to be starting in November. So Dominique and Elliot, thank you so much for being here today. I think you have a captive audience, and they're looking forward to being able to hear what the CCOs have to share and then to ask questions. Which would like to go first?
Great. Well, we are going to split up our presentation, and I'll go first and then hand it off to Elliot. And just for a time check, how much time do we have for the presentation today on the agenda?
About a half hour, like with 10 minutes for questions.
Okay. Yep, we can definitely do that. And it's so good to be here today. Thank you for inviting us. I'm sharing my screen. And I should be able to see the chat and any hand raised, I believe, but if not, please feel free to interject and stop. So I'll introduce myself again. Dominique Lopez Stickney. I'm Trillium's Senior Director of Medicaid, and I'm co-presenting today with Elliot Skye from Pacific Source. And we're going to be talking about the health-related social needs, HRSN, some background, some information on the benefits, the community capacity building funding, and provide some resources at the end and some time for Q&A. So the two main areas we'll talk about today on the left, the health-related social needs. It sounds like folks are well aware of the housing supports. That goes live for a population segment in November of this year. Nutrition supports goes live January 1st of 2025. Climate went live in March, and then outreach and engagement essentially goes live and accompanies each of these housing, nutrition, and climate supports to provide that the outreach, engagement, and connection for potentially eligible members to the CCO to get that benefit. And then we'll go into more detail on the community capacity building funding, which really is funding that each CCO gets to award in a grant format to organizations who intend to be HRSN service providers to build capacity and that infrastructure so they're able to successfully do that. And you can see at the bottom, folks may be aware, depending on how close you are to HRSN, that we continue to get updated information from OHA. And so this information is to best of our knowledge at this point in time, but just know that information might change as we get closer to the go live dates for each of these benefits. So to lay a bit of a foundation, HRSN is a part of Oregon's 1115 demonstration waiver to really set the stage of how do these benefits fit into a bigger picture. Each state can apply for a waiver and ask for specific things that they want to test and implement. You might hear this called, demonstration or pilot project. And so that's really what HRSN is. And it was approved by CMS in October of 2022, and it goes through September 2027, this demonstration or this pilot, how it is right now. And this is a new benefit, the health-related social needs for Medicaid members. And you can see how it fits in with all the other benefits: dental, non-emergency medical transport, pharmacy, behavioral health, and physical health. And so HRSN, or health-related social needs, is a new benefit for the CCOs. So I'm going to go over in a little bit more detail for each of these benefits. So we all have this working from that same level of knowledge and information. So starting with climate devices, this is the benefit that went live March 1st of this year and provides medically necessary devices, air conditioners, heaters, air filtration devices, mini refrigeration units to keep medications cool, and portable power supplies to be able to operate durable medical equipment, like, for example, if the power goes out. And for the housing services and things, continue to evolve with this for housing services. For a little bit of more information, The CCO should get a draft contract from the state mid-July. So we should really have, a lot more information at that point. But right now you can see the different services that fall under housing, rent and temporary housing, utilities, housing navigation, tenancy sustaining services, and then home modifications and remediations. And then the last big area for HRSN, so we've got climate housing and then nutrition, and this starts in January. So we've got nutrition counseling and education, medically tailored meals or pantry stocking, and fruit and veggie prescriptions. And then, like I mentioned a little bit before with outreach and engagement, right now, outreach and engagement is a current benefit that kind of accompanies the climate benefit. But once housing and nutrition benefits are live, it will be available for that as well. And so this can happen at the CCO. It can happen with contracted HRSN service providers. So essentially, community partners could be county, a community-based organization, could be like a clinic type of organization. Essentially, those would be contracted with the CCO to undertake these services and then invoice the CCO and then get reimbursed for providing those services. So this is just a nice visual on, I've talked just verbally a bit around when each of these goes live, but I would imagine what this group might be most interested in is the housing benefit, and that it will go live in November for those at risk of becoming homelessness. And, that the scope of that benefit in November continues to evolve a bit. And right now it's those at risk of becoming homelessness in order to keep them in their current home or dwelling. And then you can see on the right side, still to be determined when the housing benefit will launch for remaining eligible populations, which include those who are currently homeless. One thing that I've learned throughout the implementation of HRSN, and the way I think this slide really, this visual, does a really good job at really describing who and how someone is eligible. First, they need to be a current Oregon Health Plan member, and they need to be in one of the covered populations that you see in the middle, and they need to have a clinical health need. And then finally, on the bottom right, they need to actually have a need for that HRSN social need. So a need for the climate device, a need for the housing supports, or need for the food or nutrition supports. And then we won't get into a lot of nitty-gritty detail, but you can see on the bottom right in the asterisks that some benefits will have narrower eligibility criteria. Like, for example, looking at the housing benefit, the home modification and remediation, members have to have a specific clinical condition to qualify for the modification or the remediation. And we're still waiting on getting that information. But in general, this is how the benefit is structured for each of the HRSN services. And then this will be my last slide, and then I'll hand it over to Elliot. Folks may be familiar with HRS, health-related services. So not to be confused with, on the right side, HRSN, health-related social needs. HRS is live right now. These are actually non-covered services that really supplement the Medicaid benefits right now. It's like, so for example, a CCO may get a request from a member or a CBO or a clinic, the member's provider, saying this member has a need for housing supports or a climate device, something like that. And then each CCO, has maybe like a different or similar process for getting that approved and getting that flex funding over to that member for that service. But it's really, you can see like really a more reactive approach, and just kind of like as needed as we get those requests in, versus the health-related social needs really are a benefit. Like I think about it like a benefit like any of the other that we saw in that pie, that there's a grievance and appeals process, there's a authorization, denial, appeal rights. And so I really want to impress that, you know, the health related social needs, it really does go through, you know, a maybe same or similar process as getting that authorization for other benefits. Okay, and I'm going to hand it over to Elliot to finish us up.
Hi again, I'll also repeat my introduction. My name is Elliot Sky, Program Manager for Pacific Source, focusing on health-related social needs. So I've been steeped in this all day, every day since January when I arrived at Pacific Source. Just to share, not knowing exactly where each person within this group is on this board, also others listening in, not knowing kind of where you're at in this process. We're providing a kind of a gross overview of all of this. The content that Dominique just shared on is really member focused. It's also something that organizations who are interested in becoming service providers need to understand. It's really what I call the meat of the presentation, really understanding the new benefits that are coming live. I'm going to talk a little bit more focused on content that's geared towards potential service providers, organizations that want to be involved in supporting these benefits, supplying these benefits, really working with members to get them connected to these benefits. So to transition that direction, we, both Pacific Source and Trillium, are utilizing Connect Oregon, also called Unite Us. Unite Us is the national title, Connect Oregon's local title, to manage these requests, referrals, care coordination. This is the software that organizations will interface with in order to provide that closed loop experience when they have a benefits request on behalf of a member. And if you could switch to the next slide, please. So the reason both of our organizations set this up is really just to streamline the process, to really connect organizations together, interconnected organizations within what we call a HRSN service network, provider network, and really to improve the security of information, reduce risk of information loss, and improve efficiencies across the board, trying to streamline this process to make referral applications, fulfillment, and reimbursement as fast and easy as possible. And next. To give a little bit of a broad perspective on what this looks like to interface on behalf of a member, an organization or a person can identify a member who's eligible for health-related social needs services, submit that request through Connect Oregon, or there are various other ways that a request can be submitted. Our CCOs, Trillium and Pacific Source, will receive that request and will complete the eligibility and authorization services. We can create a care management plan and send that referral to an HRSN service provider. As a note, based on this kind of interconnected network of service providers, it could be that the organization or the person that submits the request isn't necessarily the organization or person who fulfills that benefit request. So within the Unitas network, it's just an easy way to send that to another service provider potentially for them to fulfill it. That organization then fulfills the request, closing that loop, and submits an invoice to the CCO for reimbursement for the services that were provided. Next slide. I'm going to pause here for just a moment, maybe give an opportunity. We can wait until the end for questions, but if there are, before I transition into our grant and then talk a little bit more about our service provider network, just want to pause and give an opportunity for questions if any come up so far.
I do have one question. Elliot, this is Mike Fleck. We spoke a week or two ago about this. You had mentioned there was a draft reimbursement that was available. I was just wondering if you could send that out, because I guess that for me is one of the biggest pieces is, can we actually afford to provide these services? And so that's kind of, I don't know if you want to get into that in this presentation at all or not, but I know for me and the agency I operate, we just can't afford to lose any more money. If we can at least maintain, status quo, we're thrilled. But that's kind of the make or break for us.
Yeah. Just taking a quick note there. Yes, I think it's great to get into that. It's we can go into that and kind of talk about it within our questions. What you're referring to there is the fee schedule that's in draft form right now from OHA, and is the reimbursement for these services. And so OHA has outlined we already have a fee schedule for climate services. Those are live. We have a contract for climate services. Those are laid out. With what we don't have yet is the housing and nutrition fee schedules, and we don't have that contract for those benefits. They are not yet live, and so everything right now is within draft form. I'd be happy to send that out so that you can look through it, and then happy to take questions and follow up on that fee schedule in the future as well. And I'll certainly provide my email and contact information to go into detail on a organization specific level, because what you're bringing up is really important. It's as organizations are identifying whether or not they want to become service providers, they need to identify what kind of services they're planning to provide, and create a budget, create a sustainability plan around how they're going to be able to provide these services. And so obviously the reimbursement side of these benefits is an important component for organizations who are trying to get involved. So I'm happy to go into that a little bit more and follow up on a specific organizational level if you have further questions on that. And then I see a question for Chris, from Chris.
Madam Chair, hi, Elliot. Thank you for this presentation. May I ask, because a lot of the nuance that we have to work through as providers and community members is the rules set by HUD, the rules set by state, et cetera, et cetera. Do you know if this funding would count as braiding or commingling with some of the governor or federal programs?
I can't speak specifically, and Dominic, please feel free to jump in after I give a short response to this, but I can't speak to specifics on other funding sources that organizations have available. There are different funding sources, whether state or federal funding sources or grant funding sources that a lot of organizations have in their budget or are able to provide services from, have their own rules and stipulations as to how they have to use those funds. It could be braided in some ways, aside from not knowing the specifics on regulatory process or what the regulations are for those other funding sources. There are opportunities for organizations to evaluate or to be able to use these benefits as a way to, utilizing these funding sources instead of in lieu of other funding sources. So it does have the potential for opening up other funds that have been previously been spent on these services for eligible members, and being able to utilize these funds for eligible members instead of those previous funds. Does that answer your question, Chris?
I think, thank you for that.
Yeah, and Dominic,
I can jump into, and I am less familiar with maybe like rules around the other funding sources, like who and when or how they're used, but this is something that I'm really interested in knowing more about. And we're hearing from community partners as well is, this is a limited benefit that a member can get for, if we're thinking housing, for example, and what happens after they've, tapped into that benefit. How can we braid other funding sources into that? So it's something that, we're asking that question at Trillium, and would like to better understand that, and to really like map out how this all looks, so that at the end of that period, like that, let's say 6-month period where someone gets a housing benefit for HRSN, what next?
And from the all-in side, my understanding at this point is that as long as if you're actually receiving dollars from the CCOs for the HRSN benefits, you can use those dollars to provide supports above and beyond what All In is paying for. And so, for example, you start a program that provides bus passes for the folks in your shelter. That's perfectly fine. And then you just wouldn't use All In dollars to do that. So I'm happy to talk through specifics, and it might be that I need to check our understanding with the state, but at this point, to provide something above and beyond with your dollars from the HRSN benefits would be fine. The great thing with the HRSN benefit dollars is that they're fully flexible. You get those dollars and then you can decide how to use them in your agency. They're not necessarily having to pay for the rent assistance that you provided. If you have other dollars to pay for the rent assistance, you could use the reimbursement, in a different way. And so that's the beauty of Medicaid funds.
And were there other questions?
I don't see any others online.
So we can continue, and we have time at the end for questions as well. I'll move on to talking about the Community Capacity Building Funding Grant. So another mouthful, another acronym, hence why we always say HRSN and CCBF. The state decided to make these quite long acronyms. This is for organizations who have identified that they want to become HRSN service providers. So if an organization has looked over the benefits, the eligibility, their own mission as an organization, and recognize that it aligns with what they're trying to do, they can request funding from our CCOs in the form of this grant to support the organization in their readiness to become a service provider. Next slide. In terms of eligibility, most all organizations are eligible for these funds. There's a few on an exclusion list that are pretty specific as to who is not. Almost everyone who has been interfacing with these being a potential service provider does align with eligibility type. And then there's kind of the mission of the organization. The organization needs to provide housing, food, climate, and/or outreach and engagement services, intend to serve eligible populations, have strong community relationships, and are able and interested in building the capacity to meet the HRSN service provider requirements. Next slide. There are 4 categories of funding under the CCBF grant. And really what this amounts to is, my recommendation to organizations as they're going through this process is to really start with the benefits themselves, really understanding what is HRSN, how is it going to work, and then looking at their organization as to what they're going to provide and identifying where they need assistance in preparing for these benefits. So that might look like technological assistance, staff training on technology, software purchases. It could be business practices, developing policy and procedures. Again, more training, administrative support. It could be increasing their workforce. This grant is able to staff positions for up to 18 months and recoup some of the costs around recertification training, costs for staff, sorry, fumbling over my words there. And then also a component of outreach, education, and convening. This is an organization can utilize this grant funding to support outreach events, learning collaboratives, and community engagement activities. Next slide. Dominic already started, well, actually, I don't think she's mentioned this, so I apologize. We are in a current window of funding for this grant right now that closes at the end of this month. For the sake of this presentation, that's pretty darn soon. That is the first of 2 funding, maybe possibly more, but 2 funding opportunities. The second is going to be in early 2025, that there'll be another grant window available for these same funds. Moving on to the next one. So I want to switch gears a little bit away from the grant and share a little bit of information to you all about in our shared communities, Trillion and Pacific Source are both looking at potentially setting up a model that includes hub organizations, service providers, and connector organizations. So we have here some potential roles of a hub organization who could be providing network development, contracting oversight, could be providing member referrals to HRSN service providers, coordination of HRSN services for members, provider invoice processing and payment, and reporting related to HRSN service provided. And again, I will just reiterate a part of this, what I want to share about this hub model within our region. This isn't something that every CCO is doing across the state. This isn't something that OHA has outlined in their documents about recommending that there's hubs. This is something that our organizations have looked at especially looking into the medium to long range for these benefits as we identify growth and development of HRSN benefits in the future. We've recognized that having a potential organization or organizations serving within some of these roles could be really supportive of developing a really robust and thorough network. And so this is a role that we're soliciting CCBF requests for and also engaging with organizations on. Next page. In contrast, there are also HRSN service providers. This is a role that an organization can play or can participate in, setting up a contract with hubs if they're established, or RCCOs for closed loop referral systems, generating HRSN benefits requests on behalf of members. They can do that both internally or through hubs, providing reporting and oversight requirements maintained by hubs, and of course, providing the benefits themselves to members. Next slide. We also wanted to highlight culturally specific organizations within this work. There's a lot of important conceptualization language around what roles culturally specific organizations can play within this network of service providers and how we support cultures and populations of underserved individuals who are poorly represented in our health systems, who have trouble accessing their health benefits, trying to create a strategic plan around bringing in community members and organizations who interface with these populations and building them into our systems. These organizations can act as connector roles, which I haven't talked about in this yet, or become a service provider themselves. To highlight, I'm not actually sure if we have a slide in this slide deck, and I apologize, on connectors, so I'm gonna just speak on that since it's listed in the slide. Another role that we want to highlight is an organization who focuses more on outreach and engagement, or outreach and coordination. They can either set themselves up to be an HRSN service provider and get reimbursed for their time that they spend doing outreach and coordination, or they could not want to go through the hassle, or it's not worth it to them to become a contracted entity as an HRSN service provider, and they could be providing, they could still be integrated into this system as a connector. Next slide. We wanted to provide a little bit of a visual aid. This is a busy slide. It's in kind of, it's just a way to bring forward these concepts of these different roles, and bring them forward in a visual way so you can understand a little bit clearer what we're talking about here. I apologize, this slide was something I set up for Pacific Source, but you could add a dash and add Trillium to the top of this as well as a CCO who would interface with this process. But you would have your hub in housing or nutrition or both, who is playing this kind of central role within this organization, taking some of these administrative high-level tasks and kind of taking them to the ground level and really coordinating with the networks to provide a robust array of services along with these HRSN service benefits as well. These HRSN benefits as well. So what this could look like is a hub could be providing, Pacific Source and Trillium providing oversight over the entire network. The hub can be also having a subset of oversight over the HRSN service providers, and those service contracts could be set up with the hub themselves, or as initially they're going to be set up, they can be set up with Pacific Source. We wanted to identify those culturally specific organizations and what kind of a role they can play within this. A really important aspect, again, is creating front door access to those populations who have trouble interfacing with our networks, and really creating a robust communication loop with those organizations so that a member doesn't have to be passed along to multiple layers of this chain. The service providers, of course, are fulfilling the benefits themselves. The hubs could do that as well if they have a service provider contract. And the hubs would hopefully be tapped into additional resources in the community, really having that robust oversight of what is available to all people in our community, whether or not they qualify for these services, and looking into the previous question of, what kind of wraparound services can we create? How can we create a robust service plan for members so that we can really take into account all of their needs and be able to support them. And next slide. So that is our presentation. We kind of landed with some time for questions, which is great. We have a lot of supplemental information that can be shared. I have, a long list of links that are both really dense and go into the nitty gritty on these benefits and these processes, as well as kind of overview content that's a little bit more digestible and helpful as organizations and people are kind of conceptualizing this overall. And then we can share this obviously through the slides, and then we can also send out links if that's helpful as well.
Thanks, Elliot. And then for Trillium, for folks, just because I get this question a lot of how would an organization or a member refer for HRSN? And so like Elliot said, obviously refer through Unite Us, the Community Information Exchange. And then these are the other points of contact. Really no wrong door to get that referral for HRSN. At this point, climate is the only benefit that's live. But this is the info if you want to refer or self-refer to Trillium for HRSN.
So that concludes our presentation. A lot of information crammed into a short period of time. And I'm sure people and organizations have more questions. Again, we're happy to field them here. If there's some specific organizational questions, we're both happy to do follow-ups, answer questions through emails, or set up one-on-ones with organizations who are in the process of applying it and want to, run ideas by us or learn more. That's a high priority for both of our organizations right now to support people and organizations as they're applying for this grant and looking to become service providers. So with that, we'll turn it over to questions.
While we're standing to see if anybody's hand goes up, I'm going to ask two questions, which is, I think there are a lot of providers in the room who do shelter, street outreach, and other services where they're working with Medicaid recipients. And so I'm wondering, is there a place that they could be sent to, or presentation or something that would help them understand the benefits that people are eligible for? For example, I know flex funds was mentioned in this presentation, and I know what they are, but I think it would be helpful for those providers to understand how members that they're working with could access some of the other benefits and what they would be eligible for. And then my second question, I'm going to throw that out there and you guys can answer both, because we are working on advocacy and staying within the scope of the PHB. If there are, as the state rolls these things out and they're making decisions on eligibility and reimbursement, if we wanted to advocate for changes or additions, if you all could let us know where we would send that to. Thanks.
Yeah, thank you. Those are great questions and points. This is an evolving process. OHA is the ones, if you're looking for kind of a point contact to OHA, they have internal teams that are working on developing these, and they've been soliciting feedback on their fee schedules. There's been a lot of work that's been going on, obviously, around these benefits, a lot of meeting spaces for both CCOs to provide feedback and also community members. So OHA has solicited a lot of feedback in this process. And again, the reimbursement side of things is still in draft form. And yeah, I'd be happy to again provide try to figure out what a good contact point for OHA would be if there's any organizations that have want to provide specific feedback on the fee schedules, especially after we send out the draft form and you all can look it over. I also wanted to highlight, I'm realizing that one thing that'd be helpful, and I think Dominic did touch on this, but I want to reiterate it again. When OHA is developing what are the available benefits and what the eligibility is for housing in particular, they've taken what is a little bit of a broader scope that was submitted to CMS in the initial waiver and narrowed it down a bit for the launch of these benefits. So the benefits that are going to launch November 1st for housing are going to be for people, members who are in current housing and need supports to maintain their current housing. Then the next phase of eligibility should, and I say should just because I'm not in charge of making the decision, broaden to members who are have identified housing, have found housing, but need supports before they can get into that housing. So if somebody has identified, oh, we're going to be able to have a rental in 2 months, but we need supports to kind of get us to that point, or we need supports to move in to that new apartment that we got. That's kind of a next phase, and OHA hasn't set a timeline specifically about when that will take place, but that is a next phase that's covered within what has been approved by CMS. And then a third phase would be supporting members who are actively homeless and finding housing and getting set up in housing. So I think that's an important point to kind of understand from an organizational level as organizations are looking at becoming service providers, and for members as well as they're understanding these benefits and what they can take advantage of or not. And I see a hand up from Pat.
Thank you, Chair Murphy. Thank you. This is less of a question and more of a comment for you and Dominique Elliott. From my perspective, I really appreciate your presenting together. Elliott, you mentioned a slide. There's one that is the Housing Nutrition Hub slide that you put up, and that had Pacific Source at the top, and you said you could substitute Trillium's name. I'll put /Trillium on the top of that. I personally really appreciate when the CCOs are working together, because it seems that 1 + 1 equals far more than 2 when you're working together in such fashion, and I really encourage this kind of presentation. Kate Budd and Chair Murphy, thank you for arranging this, and Amanda Boda, you may have been involved in that also. Fantastic presentation. Thank you.
Yeah, Pat, I appreciate that call out. Our organizations have come together a lot behind the scenes and discussed this kind of a hub model, what our networks could look like. I think the acknowledgement that within Lane County, we share members, and for many organizations, pretty much all organizations, they're likely to have served members of both of our CCOs. So we wanted to have a cohesive plan and a cohesive service provider network that develops, that supports all our members. We couldn't really do this effectively if we had two different, completely different ideas of how to serve our members, and we're trying to develop two different processes. In all honesty, that really wouldn't work very well. So I appreciate that call out.
And thank you. I'll issue you a very large bravo, and thank you very much.
Thanks, everyone. And
And if I may, Elliot, there was a question regarding kind of the concept that first there's a focus on people who are at risk of houselessness, and then, transitioning to folks who are, needing their like couch surfing and then needing to get into housing, and then thirdly, folks who are houseless. And the question is, why stagger as opposed to split for the three streams?
Yeah, I can share my perspective. It's, OHA is the decision-making entity within this process of deciding how those stagger out. So they're the one really digging into these systems. What they've shared with us is that, they're just wanting to make sure that our processes are straightforward and aligned right off the bat. And I think they had some apprehension around bringing all of the potential service categories forward in the very first, come November 1st, everything coming online. I think they're just identifying that it's the more targeted approach to those who are in current housing and need assistance to stay in housing is both more manageable and also very needed. So I think to go into like a really detailed answer, we'd have to talk to OHA about, what their methodology is there, but that's kind of what I've heard described to me. And Dominic, if you have anything to add to that, feel free to jump in.
Yeah, really similar. And, we have to keep reminding ourselves at Trillium that this is essentially a pilot, a demonstration. So being able to really successfully implement this from day one is really important. And then phasing in other population segments, at a later date, I think is the main driver there.
And I would like, maybe I'll piggyback on some of my more recent, and this comes from I'm not a housing expert, I'm not a nutrition expert either. So I've, been tasked with understanding these benefits while also learning a lot about housing entities and what supports are needed. And one of the things that was brought up recently, which was, eye-opening to me, was an organization who deals with finding housing for people who are homeless, was also interested in becoming a service provider because they identified that a part of their scope is providing supports for members once they do get into housing. And so they were looking at this in terms of, well, right now these benefits members aren't qualified for these benefits if they are homeless at this moment. However, if we use our current systems and funding channels to get people into housing, we can now rely on this as a Medicaid benefit, as a dependable source of support for that member once they get into housing to be able to sustain that housing. So there are organizations who are looking at how to integrate even day one, November 1st eligibility, aligning with their what their organization is providing, even if it's not directly providing support in itself to those who are homeless right now.
Thank you. We're going to extend a couple of minutes for one more question.
There were a number of questions around HIPAA and to what extent an agency would need to be HIPAA compliant and what that would look like. And I did get your response, Elliot, but thought it'd be helpful if you wouldn't mind sharing that with the bigger group.
Yeah, and it's funny. I'm trying to now recall when I gave you a response and what that response was, because this is an evolving area for me. I've reached out to my OHA contacts to ask for specific language around HIPAA, and they're not in a place right now to provide that yet, which means it's all being figured out and developed. So I've seen some concepts around whether or not these organizations are going to need to be HIPAA compliant. I think that there's still discussions around that. It may be that organizations don't need to fulfill HIPAA requirements, that these organizations aren't going to fall under that lens. There's some, if I had the language in front of me, I might be able to pull up more specifics on like why this is being looked at this way. I can't speak to definitives right now, and I wish I could, but I can't speak to definitives right now of whether or not organizations will have to go through kind of a robust process to become HIPAA compliant, but it's might be leaning a little bit more towards those organizations not having to go through a rigorous HIPAA compliance process, just in the way that these benefits are being interpreted. And that's something that the state is worked with the federal government on, and really trying to create alignment on what HIPAA compliance means for these community-based organizations as they're delivering these benefits.
That's great. I imagine good news for many.
Yeah, and again, I want to throw a caveat that this is something we're kicking around internally at Pacific Source. We haven't come out with what our statement is going to be around this. I think there's more work to be done to really develop, a really clear, here's what the expectations are for organizations. I'll just acknowledge the challenge of organizations, applying for this grant by the end of this month with some of these uncertainties, not having a clear fee schedule that's, contracted yet, not having some of this like really clear language around what does it mean to be HIPAA compliant. These are all I want to acknowledge those challenges as organizations are going through this process, but it is also where we are. So.
Thank you so much for your presentation. It's very, very helpful. And with that, we might invite you back as we get close to 2025 and some of those questions are answered, and the next round of grant funding potentially will be coming out for this benefit. So thank you both for joining us today.
You're welcome. I think we're both excited to be back and be here and, continue to share this information. It's, really important for the success of this program that everyone really understands this, and it's all happening quite fast. And I appreciate your interest and willingness to have us here.
Thank you. And with that, I think it is to you, Kate.
Sure. And Elliot and Dominique, again, thank you so much for joining us. Really appreciate it. And anything that you think might be pertinent to share with this group, feel free to send my way and I can send a follow-up. I'll also offer that there's a large amount of information on the funding opportunities page in the PHP packet as well. And so you might reference that if you're looking for more. Appreciate Chris's question about the slides, and Dominique and Elliot, wonder if you'd be willing to share those with me and I'll get it out.
Yeah, we can definitely send those.
Great. Thank you very much. All right, so we're gonna shift a little bit and start looking at the process that has been drafted for the PHP strategic plan. We talked in the last 2 meetings just about the opportunity to move forward with strategic planning, and had an opportunity to talk to a number of folks, including some folks involved with League, and got some feedback about what a process to do a strategic plan would look like. And the hope at this point is to have a dialed in draft by the end of the year, which seems like a long time, but in strategic planning world, it isn't. And so what has been kind of thought about is firstly to just get focused feedback. What's going well, particularly from groups that may not be regularly engaged with the PHP. And so, for example, I know we've had asks from DV and sexual assault providers to have an opportunity to share, where they see they can have a stronger connection with the PHP and even with the overall homeless response system. Thinking about, even the behavioral and physical health providers, that they too, they're entering into this world more. And so what would they like to see, as well as meeting, with the connected jurisdictions to understand, what do they want to make sure that is coming out of this strategic plan, and making sure that we engage with League even further. They've been really clear that they want to be involved every step of the way, and have, of course, really important feedback to be able to provide. Also making sure that we're setting the scope. And so within the bigger PHB, talking about, what's the purpose of the strategic plan? Why are we doing this? What do we hope to get out of it? And then what are the actual flexibilities within the PHB? We know that we have, specific requirements that we are to meet as the collaborative applicant for the continuum of care, a very clear focus as a body to work on reducing the number of people who are houseless. And then there are funding sources that are flexible where, the county and the PHB are able to determine where do those funds, get allocated. That, of course, is a much smaller amount of money than other dollars that are much more prescribed, where, it either needs to go to one specific program type or a few very limited program types and program models. After that, going into setting community data baselines. So, what do we need to dig into further? I know that there's a real strong interest in digging further into the inflow and outflow of folks who are experiencing houselessness. Looking at the gaps, and we'll get more information about the gaps from the focus groups as well. How do we, help to address some of those gaps, and where are stagnancies? Where folks, ideally are moving from one, type of program to another, but maybe they're not moving as quickly as might be ideal. And so how can we progress that next step? And then also looking at, a more longitudinal view. I want to recognize COVID's in the middle of any type of longitudinal view, which is challenging. And we've also seen a very significant increase in dollars as a result of COVID. And so, what things look like, from 2015 to 2019 are very different than what they look like during COVID, which now is different as we're coming out of COVID. But there's certainly value in seeing, what was different and, was something, working more effectively from 2015 to 2019 that we want to dig into further. From there, identify the priorities for the PHB. Where, is their priority as far as, improving gaps, improving stagnancy, within different program types, where are there opportunities for greater investments, and where are there opportunities to be able to serve a more diverse group of folks, so that maybe those who are not being served now are able to be served moving into the future. We absolutely have an opportunity to more effectively engage folks of color in both access into our overall system, but more importantly, in exiting folks of color positively into permanent housing, that there are identified discrepancies there that we want to continue to dig into and address. Make sure that we're checking in with the PHB committees, the league, and continue to hear their feedback regarding priorities. And then after that, sort through, what is within the scope of the PHB, and then what might be a more appropriate advocacy opportunity. And so, often when, we're hearing feedback, more behavioral health supports are needed. We might even talk about the stabilization center when we know that that's not within the PHB scope. And so there could be advocacy opportunities to, have additional programs through behavioral health that can support people who are houseless and are utilizing models that are more effective for folks who are houseless. After that, create a draft plan and do that with a subset of PHB members, so smaller group of PHB members who are interested in digging into that level of detail. Once a draft is created, then share not only with the PHB, but again with league and the committees of the PHB to be able to gain feedback on that draft. Make sure that draft includes, desired outcomes from the action items, and then also those advocacy opportunities that I mentioned. And then lastly, after bringing that feedback in, making needed changes to the draft, moving it out again to the different groups to be able to adopt and move forward. We hope again that we would be doing this around the end of the year into the new year, so that as we go into 2015, we have a plan to be able to move forward with. Our plan would be at least 3 years, and I don't want to say not 5, but I doubt it'll be 5. I think there's too many moving pieces to really go to 5 years, but it is such an enormous process that we also want to make sure that the plan is for an adequate length of time where we're able to see a number of successes and move beyond just one biennium. So after sharing all that, I'm interested in feedback or if you have any questions regarding the process. Very interested if there is a focus group that is on your mind. Feel free to share. I have heard, even through my conversations, that there are entities that feel disenchanted with the homeless response system, and certainly respect that. And strategic planning is a very appropriate time to make sure that we're having that conversation and hearing, why that is, and working to try to address how we might be able to be stronger partners in the work. And, it's very important feedback to bring into a plan like this. So those conversations are important.
Yeah, I just want to say that I given how much things have changed pre-COVID, COVID, post-COVID, I mean, right, you say, there's so much more money in the system, and there's a lot of experience that we've gained in that time. So I sort of appreciate the reset in a way to sort of actually look at the system. It reminds me of the early work we did on the TAC report, right? Looking for those gaps, but probably even much more robust than that was.
Well, I don't mean to be the negative Nelly in the room, but there's not enough money for everybody in the system. And, and that's a real problem, because we're going to have to talk about whether we want to provide certain services or not. Our agency is facing right now about a $90,000 deficit. If I cut every program, we're going to be $37,000 in the hole. So, there's not enough money in the system. And part of it is because during COVID, we started a bunch of great programs that now we're funding. And so I love the idea that we're going to do strategic planning, because I'll be honest, I'm one of those disenfranchised guys. I mean, prevention is cheaper and is going to be much more effective, and yet we've basically just gutted the funding to it. And I apologize. I know that this is a personal thing for me, but it's also from a global perspective of the system. What are we doing? And I don't know. I think the advocacy may be that we need to get more money in the system overall, because clearly we're not doing enough for homelessness either. So I'm not trying to point fingers. I'm just saying that, yes, we need to put our heads together. We need to find a solution, because we won't survive. I mean, period. We won't survive.
And I think through all of those years, pre-COVID, post, it's been up and down. So some things have been funded, and then the funding was taken away. And then new things were funded, and it's kind of been all over the place, which I understand, like with the 3 years of, it's really hard to predict where funding and where everything will be in 3 years, because it feels like a moving target sometimes. And so we make progress and feel like we have the house of cards together, and then something changes within the system, and then we have to figure out how to glue that leg back on. So that's rare. Having the focus groups and getting as many people involved as possible to get feedback on where we need to focus is so important. And then Chris.
Thank you, Madam Chair. Thank you, Kate, for the presentation. I would like to be part of the strategic talks as we've worked. I've had the honor to work with this group for 7 years. Several folks are coming and going. Several people have since left this world. And so whether they have lived experience or whether they have electoral experience, every aspect is going to help us navigate as a community. With that being said, we have a lot of opportunities, such as what the folks from earlier, what the CCOs have done, what we've done with the governor's money, both for the all-in projects, but also whether or not we are supporting the work that's going on in rural areas, such as Councillor Fleck's community sharing, which feeds the people of Cottage Grove and Crestwell and that greater area. We have those healthcare providers such as HIV Alliance and Occupy Medical who are going on their own dimes, sometimes down into the rural areas to try and help people where they are. How do we factor in a different system that's not first past the post and not like first come, first serve through Eugene? That's what I would like to just highlight as we move forward, looking at all the dollars on the table and not just what's the easiest to get and to serve the hardest to help in addition to the low-hanging fruit. Thank you for your time.
And I appreciate your point, Chris, about the dollars. I think we've all kind of been mentioning it, is that it is crystal clear the dollars that the county receives will not be adequate to, be able to really move the needle, and that continuing to incorporate additional dollars, whether, it's the HRSN benefits, whether it's, dollars that come from other entities at the state, not just Oregon Housing and Community Services, are going to be really important. And the other benefit of the strategic planning is sometimes if there's something that's relatively baked that you can offer up and say, we need money for this, it does go a long way to being able to actually, receive dollars. And so I think that's the other opportunity, is to kind of shop around, like, this is clearly something that we'd like to do. And so it's not just for the dollars the county receives necessarily, but other funds to be able to help build out that broader system.
Thank you. And we are ahead and moving forward. We don't have additional discussion. That'd be Carly.
Have my things pulled up first.
Oh, go ahead.
Okay. Sorry, this will take me a minute because I logged out. I got focused. So last month, we talked a little bit about the longitudinal system analysis and some of the information that we submit to HUD each year. And I imagine some folks are really excited to hear about the PIT counts, which I do not have prepared because the submission deadline, there were some issues with HUD's website and it got pushed back a lot. So we actually only submitted the PIT count last week, which is super late. It was a interesting experience. Let me make sure. Okay. So I'll have PIT count information available next time. Today, what I wanted to talk about was, I could also just walk over there.
You're okay. Now it's on you.
No pressure. Okay, so what I wanted to talk about today was just to dive in a little bit to exits, because we talked big system map and lots of information last time, and it's really hard to dive into all those pieces at once. So I picked one that I felt like was relevant to what we talked about last time, which is exits from our shelter and housing programs. So emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing. This is different from who is housed. This is who left those programs. So in rapid rehousing, if you have been helped into housing, you have 2 years of up to 2 years of support, like rent support, until you need to leave and exit that program. In permanent supportive housing, you might stay in a program for 15 years or more. And I've definitely seen some of those. Like, that could be a success, right? So exits are who left those programs, and when they left, where did they go? So the graphics I shared last time were around how many people and households did we serve. Last year, so that October through September, we served about 3,900 households. So some people definitely stayed where they were, and that's great. Of the folks who left, of those households who left programs, 11% of them 11% of those households exited to permanent destinations. We served way more households. So if you look inside of these circles, you can see how many households did we exit and what percent of those were positive. But we're definitely headed downward in that trend. So we're able to exit and serve more people. But to me, what this is we really didn't have enough places for them to go. So I know last time we talked about, like, can we expand our shelter resources? And that's definitely an option. But if we don't have more places for folks to go, like, this number is just going to keep going down, right? So perhaps the number of people we exit to positive destinations might go up, but those percentages will still stay quite low. These PDFs came out a little bit odd. Let me see if I can switch to slides. Sorry about that. Oh, of course I opened like 3 things at once. So thanks for being patient. There we go. I'll reshare. So exits, you know, we definitely have opportunity for improvement. In this slide, this is just the current year. Yellow is we don't know where they went. So over half of households, when they left, we don't know where they went. Orange is temporary destination, so that could be the streets. It could also be family or friends temporarily, jail, hospital, some places like that. Green are positive. For adult-only households, that exit percentage is quite low. For adult and children, it's quite a bit higher. And for child-only, this is a small number of households, but it's higher as well. Most of the child-only are family reunifications, so they're able to head back home.
Can you just clarify for me, where are they exiting from? What programs does this embrace?
Sure. Yes, I can tell you exactly.
Oh, perfect.
Yes, right along the same lines, right? So before I get there though, the one point I want to make is most people, we have no idea where they went. So it is possible that it's higher. I don't think it's likely that it's higher. Just most of the people, like, we're just losing track of them. And this graphic I recognize is a little bit hard to see. On the left side, it says for each type of program people participated in during this period or on their way to exit, how many households did we serve in that type? What percentage of those households served were in that type? So all the households we served, 90% of them were shelter only. They didn't touch any of those other housing programs. They went into shelter and they left from shelter. On the right side, you can see of people served in that house of that pathway, what percentage of them were positive. So if they only touched shelter, which is most of what we're doing, the exit percentage was really low for permanent destinations. The blue bar is what our average was. So our TH only, if you only did transitional housing, you were much more likely to be successful. Or rapid rehousing only, much more likely to be successful. Some of these are really low household numbers though. So you can see who went from shelter to transitional housing to rapid rehousing. It's one household who exited positively. So 50% is really cool, but it's a really, really small number. In general, we have tons of people going through shelter. And then some of these other pathways are really, really limited in who's able to access them.
And then I think Mayor Venice and then Commissioner.
Yeah, so clearly not looking at this chart, very high, much higher percentage of people who were in some version of rapid rehousing had a greater success.
Right.
So presumably that's a more functional segment of the population, right? I mean, they're eligible for rapid rehousing. I guess the question I have about this is if you're looking at emergency shelter, you may be looking at a population that is just going to have a harder time exiting to permanent housing because they're just that much farther down the scale of really sort of being able to manage that. So I guess I'm wondering if this is not just a reflection of programs and bottlenecks, but also a reflection of the demographics of the person you're serving.
It could be all of those things. Typically, the folks who are prioritized for, you have to be more vulnerable to make it to a rapid rehousing or a permanent supportive housing program. So, but there's so many households just captured in that shelter section. There's a lot of different things going on in that population. When we could dig down too, like into household types and
So do we follow up? I mean, I guess the question is, I know in the rent assistance, we're calling up in 6 months and a year afterwards, and then we're entering that in Service Point. Are they doing that, or are we just looking in Service Point to see if we're actually finding a destination? I'm kind of curious.
Great question. Yes. So if they do exit somewhere positively, they do follow up 6 months later. But in terms of how do we know where they went? Everyone reports the exit destination. It says this is where they landed. And if they came back, it's because they enrolled in one of these project types again. So that would be the returns question.
Thank you,
I
Carly.
was actually just going to chime in for you, Lucy, to answer your question a little bit. You do see a little bit more successful individuals coming out of rapid rehousing because usually they have a little bit less barriers than those coming out of the shelter. And I think you guys spoke, Sean spoke to the BHUs or the lack of thereof. When we have folks at the shelter, it does take a lot more resource, linkage, and brokerage to get them versus somebody who's more rapid rehousing eligible, which permanent supportive housing, you do have to be a lot more vulnerable to get that. But if there's not a lot of permanent supportive housing options, they kind of just not necessarily slip between the cracks, but they turn into kind of stagnant in the shelter because their exit from the shelter to either long-term housing isn't necessarily a feasible option because of the lack thereof.
Right.
So that kind of will explain some of the data a little bit.
Thank you.
I see there's been some chat questions too. One of them was, do we keep track of the non-positive exits? Yes, but today I just wanted to focus on the positive because I only had 10 minutes and we could have talked about this for an hour and a half. Like we could do the orange colored graph. Like I have more detail about all of these pieces and the hospice and things like that. Yeah. The other thing was, if we're looking at percentages, Peter pointed out, you know, the total number of exits rather than percentages. We had 211 households from shelter exit to a positive destination. So that far out, like that dwarfs everything else. There's a couple of reasons for that. One is folks in PSH, for them, a positive, like this isn't positive outcomes. PSH, a positive outcome is staying there in many cases. So this isn't who did we house.
Right.
This is when people leave our system, where do they go? So I would really hope that folks for PSH, if they're leaving, it's only because they have a positive place to go on the other end. But for many folks, because like Glenn talked about, they really need to be really high vulnerability to get there. Most of the time, we probably want them to stay there. So this isn't quite like who did we house? It's more when people leave, are we sending them somewhere good, or are they going to land right back in the same place again?
But that's great. Yeah, I should have seen that. The numbers, if you actually look at the absolute numbers, it's only 8% of emergency shelter, but you're serving 211 people with positive exits.
Households, so maybe even
households even more.
Right.
So that's actually the big success numbers there.
Yes. But really, like if you're thinking about the number of people pushing through, almost everyone is only going through that shelter pathway. And there's a lot of room for improvement. Let me see, I think that's my next slide. Yes. So if we just focus on this piece, just mathematically, almost everyone's going through just that one place. So if we could make improvements in this pathway, we'd see huge improvements. Like this is just where most people are going. It's the pathway with the lowest permanent exit percentage. Besides that, shelter and PSH goes a really small number. So mathematically, it makes the most sense. And also it's just like the pathway that's doing the quote unquote poorest. I think that just has a lot to do with what's next for them. Of course, you know, some programs that are shelter are working really hard on the next steps. Like I know the Navigation Center, like you guys are working really closely with folks. That might not be true of all shelter programs, you know, or you might be serving different populations. I see Chris is saying too, like there are more places we need folks to be able to go. I'm not able to expand those definitions for positive exits for HUD, but like I hear that point. Just in terms of if we're grading everyone the same way, which is if when they leave these programs or they leave our system, are they going somewhere positive on the other end? Like is the homelessness response system helping with homelessness? This is the area where we could do the most.
But there's an important point, which is that this is an essential access point.
Yes,
that shelter system is critically important to get people into the system, even though it's hitting a barrier, a bottleneck later.
Yeah, and I think that point too about like half of households, we don't know where we go. It's mostly the shelter situations.
Thank you, Carly. And I was gonna say, now that we're collecting that data and we have more permanent supportive housing projects coming online, I think it'll be over time to be able to understand that how long for our most vulnerable community members who go into permanent supportive housing, do they have to stay there before they're actually ready to graduate and move into to independent housing?
And to like open up more slots for these the things that are lower here. So we're not only moving people to this top option. I do have a race ethnicity slide as well, but it's not coming across very well. So I know it's in the packet. I'll see if I move it from here, but I've been having some technical issues with documents today. Yeah, I can't get it. It's a blank page. I'm sorry about that. Hopefully it printed out okay for you. In general, we're looking at race and ethnicity in different ways than we have before. The census is moving this direction too. Multi options for more than one option. We have a Middle Eastern option finally, and that's going to come to the census as well. So we already moved to that option in October, and the chart I have available shows that. In general, we're doing pretty well for those populations. Some of them are really small. But we're not seeing like huge disparities in those exits for different race ethnicities and household types. It's about the same as the other populations, which is good. Are we getting them into the system in the first place might be a different question. But when they're here, like, do they exit? It's pretty similar to white households. It's not enough for anybody, but at least it's not worse. I know.
Thank you, Carly. And because we are running out of time, we shall move up to the jurisdictional updates. And I know Commissioner Farr and Mayor Van Gordon had to leave at 1 o'clock today. So I don't know if there's individuals that can give updates for them. So I'm going to start with Cottage Grove.
I will jump in. I'm sure Chris knows, but Saturday, our city council in Cottage Grove will have an all-day session that St. Vincent de Paul is going to help facilitate around homelessness in our town. We had hoped, I assume we still haven't heard whether any of the all-in money is going to keep our shelter open or not. And at this point, it is not in our budget. Because we have no indication that we're actually getting any funding. So what do we do? And so we're going to have kind of where the legal situation is, what options we have, and try to come up with some suggestions that will help address the situation. I'm excited to do it, but also kind of apprehensive because it's such a challenge. And it'll be virtual. So, I mean, it's a work session, so I don't know if we're taking input or not, but certainly folks can hear, and anybody interested in South Lane, I certainly would recommend signing in.
I don't really have anything to, there's a lot going on, but I don't think we'll have a big update for this group.
Looks like Pat Farr left, yes, a parting word, just sharing that there is a developed deflection team that is situated within Lane County. It's exciting. Retired Captain Clint Riley is helping to head that up in partnership with Alex Dreer. And so, taking the requirements that have come from the legislature and working to implement those so that if someone is, identified as having utilized substances, then there are options other than jail is basically the root of what is being worked on. And I know that their intention is to bring in, a wide array of partners, and we can certainly get an update once they start the wheels moving at some point.
Thank you. Kate, it's back to you with the agenda.
Sure. So thinking about the June PHB meeting, hoping to take some time to continue to discuss the strategic plan. At that point, hope to have had a few of those focused conversations, though not all. But we'll also start, continuing to dig a bit further into data and asking that kind of broader question to the PHB itself. So I appreciate Chair Murphy often has the question sent out ahead of time of the PHB meeting. And so we'll likely do that so folks can ruminate on those questions and we can have a discussion at that meeting and likely future meetings as well. And then we'll also be talking about the upcoming COC application. We expect it'll probably drop sometime in June or July. And so we'll need to start talking again about what new projects we would put in the application, as well as what the reallocation process will look like. And Amanda Borda is heading up those efforts. I think I mentioned a few meetings ago, but the hope is that the application will go to every other year if the federal budget ever gets actually adopted fully. So we're crossing our fingers because that would help just free up some staffing capacity to do other things than just doing the more formal continuum of care applications. So we'll hear more at the next meeting.
Thank you. And then just for a wrap up, a note from the presentation with Trillium and Pacific Source that Kate will make sure that she sends out the PowerPoint once she gets that from Elliot, and that we're going to move forward with the strategic plan. And we are all going to continue to work together as we deal with the fallout from budget cycle to budget cycle. Who got what and what was cut and how we can all work together to support Lane County overall. And with that, I appreciate everybody for being here today for the meeting. And unless Kate tells me there's something else I need to add, other than the next meeting, which is June 20th, is the all-member meeting at Harris Hall, and July 18th is the next executive committee.
And just see Chris's point about the grants pass case at the Supreme Court and, possible ripples and or decision by the next meeting. So we might want to add that in if we have the time. And that'll be, it'll be really impactful, especially if we have a decision potentially.
Yes.
With that, I don't think that actually changed 3115 though. I don't know that Oregon is necessarily going to have the dramatic change that other states will.
Yeah, and I appreciate that. And maybe that's an important part of the discussion too, just to help level set that we're not going to have that shock that maybe other states may.
Thank you for bringing that up, Chris, and we'll add that. And with that, meeting adjourned.
Thank you.
Thank you.
Yeah, you're all correct.
Oh, goodness.
Well, yeah.
No.
No.